So why did I choose STAR? What was going on in my career? So I was at a point where I needed an exit strategy. The reality was I was just overwhelmed and tired of the business side of dentistry. I pursued all the normal things like bringing somebody else in and mentoring them and having them buy it. I also looked at several other DSOs as well. What attracted me to STAR was the clinical autonomy, being able to let me do my dentistry. STAR doesn't come in and say, you can't do that, you have to do this, you have to use this. And now I still get to use what I want, what's best for the patient clinically. That's probably the most important piece of the whole thing because, we as dentists, that's what we do, right? And we're used to doing it a certain way. STAR Dental allows me to treat my patients and not have to worry about all the business stuff that comes up, behind it. It's really taken a lot of stress off me because now I can really focus on that. It's improved my quality of life and, being able to go home and not have to worry about payroll and all those things that go with it. I'm still the leader of the practice and my team still looks to me to be the leader, but I'm not doing all the paperwork. Have I seen the profitability in my practice? And the answer is absolutely yes. They have really streamlined processes and made things better so that we are more profitable. If you need marketing, they have that. If you need, help with whatever you need, they've got the support to be able to help you grow. One thing that's great about STAR and the transition is that it's not a cookbook. Kind of everybody has a little different where you are and what your needs are. So they really look at what your value, creation plan is, like, what are you really wanting that to be? And so I kind of spelled out that, I've been doing it for a long time. At some point I want to cut back. And that's kind of what I've been able to do. STAR has exceeded my expectations. And one, I really raised how much dentistry we did and how many patients we treated and how well we did over the time that I've been involved with that. So that's been a good thing, is that I grew and had the best years of my career. As far as the process of how STAR went about, and again, remember I told you I looked at multiple different ones and they were the most professional and they did a really good job of presenting it. Now, I was number 8 and now we're at 110. The great thing I look now is when I look back and I talk to my friends that are coming in, is that it continues to improve. Things that we said, hey, I wish they'd have done this different, they listened and they've implemented those things to make that process better. Because let's be honest, that's the biggest decision of your business life. It can be overwhelming. You really need to be kind of led through it the right way and have the right advisors, and they support you in that as well. So to me, as I end my career, it's all about legacy. I want to know that, that my office that I built, over all the years, these patients that I treated them and their kids and grandkids now, and I just want to know that they're still going to be taken care of, at the same level. And I feel real confident that that's going to happen just because of the way the transitions take place. And we know that that's the strength of the practice too, and we want to make sure we keep that.